thing about myself. And also, I said that today worked for me, but I do have to leave for a dentist appointment at 3:30, I realized.
Well, we'll make sure we get the introductions done in the first part here. In fact, I'll start sharing the agenda so that, and I'll put it in the chat as well. But Eileen, it's 3 o'clock. We do have a number of individuals here, and if you'd like to go ahead and start, we can do that.
I would love to. Hi, everybody. This is Eileen. I'd like to call the meeting to order, and I recognize that there are people who may be taking care of their kids. You may be taking care of your parents. There are reasons why you are as engaged as you are able to be, even though that means that your camera is off. And we're just happy that you are here. And we know that even if camera's on, it doesn't always mean that we're always engaged. And everybody is welcome and that the work is better because you are here. Because not everybody's camera is on, I will ask, though, that we try to raise our hands before we're going to comment. Also that I'll ask that we all refer to each other by our first names. Not everybody here is a doctor, and everybody here is welcome, and everybody's perspectives are as valid and as valuable. And I know that you know from having been in our meetings, well, for many of you for quite a while, then I happen to really enjoy when we do a little bit of a lighthearted, first like an introduction, and then included in that lighthearted introduction will be something that is a little bit on the a little bit personal, which is the dreaded icebreaker, which I happen to enjoy. So we're going to go with until someone makes a motion and someone seconds it, and there's a vote that says stop Eileen from having our icebreakers. So with that, I'll call on people as I see them, and then when we wrap things up, then everybody's going to get to hear from. We have a colleague joining us today, Dr. Gill, and she'll tell us a little bit about herself. So maybe our question for today, in addition to if you could say how you prefer to be called, if you can say where you're calling from today or where you're joining us from today, and I would like to hear from you if you are going to say you're going to have to die on this hill, red or green. Okay. All right. So with that, Alan, you're up. Alan, looks like you're muted still.
Oh, you're muted.
Yeah, Alan, you're still muted. I don't know if I'm able to unmute you. I think not. Do you want to try again?
Oops,
there you
I
go.
Must have double clicked. Anyway, Alan here in Deming out in the blowing, windy, dusty desert. We're making the Dust Bowl of the 30s look small. But yeah, we love it out here in the West and in chilly country and just having a good old time. So what more can I say? I'm Alan. I'm work 2 days a week and enjoying every bit and happy to be on the committee with everybody, getting to be kind of like family.
Well, we're glad to have you, and family's good. Alan, red or green?
As far as chili goes, green.
Yeah, green. Just checking. Just checking.
I'm addicted to green chili.
All right, good call. Gary, how about you?
I am definitely green. Again, Gary, here, medical director at the Center for Medical Cannabis. Yeah, green, and I become more used to it and enjoy it more each time. So green chili for me. Yeah, that's all.
Nice, thanks. Eleni?
Hello, I'm Eleni Bukavalis, calling in from Placitas, where it's actually been quite rainy, unseasonably so. It's been kind of interesting. I'm a former emergency physician currently at home with my 2 young daughters. And I would say, I used to say red, but like the longer I'm here, just green chili is just growing on me. It's just all chili. The longer you live here, I feel like all chili just becomes more and more wonderful.
Nice. Yeah. Carmen, are you able to unmute yourself?
Hello, I'm Carmen Batista. I work here at the Department of Health with Dr. French. I am a health educator. Um, and since I moved here, I would say green chili.
Sounds good. Kathy, are you able to unmute yourself? Looks like you are unmuted. Are you in a spot where you're able to talk?
Yes, I can talk. Hi, Kathy Jerry. I am an IT project manager supporting the medical cannabis program. I'm in Albuquerque, and I'm with Eleni. It's been unseasonably cold and rainy, but no complaints because we need it. And green for me.
Great, thanks. Hallie.
Hallie Faust from Santa Fe, and I can't say green or red. It depends on the food. So when I do huevos rancheros, I like green. When I do burritos, I usually like red. It also depends on how hot each one is because they're never uniform. So you have to ask, right? Which is the hotter, which is the less hot. So
I feel like the level of detail makes me wonder if you would remind me if you're internal medicine trained.
family medicine and preventive medicine.
Oh, I knew preventive medicine. Okay, just because that's like a very internal medicine answer to have like multiple contingencies there.
Well, you have to look at the data if you're an epidemiologist, right? Which is
nice. Brenda, are you able to share?
Good afternoon, everyone. Brenda Martinez, she, her, Aya. I'm the Deputy Director here at the Medical Cannabis Program, and I'm going to ditto Holly's message. It depends on what we're eating. So green chili for hamburgers, red chili for enchiladas and eggs. Those are like, you can't sway from those choices ever.
I like it. Some serious business we're talking about here. Katie, are you able to unmute yourself? I think we haven't heard from you yet.
Hi there. Good afternoon. I am with the Medical Cannabis Program. I'm the newest educator joining the team here in Santa Fe. I just moved up from El Paso, and most days green, but once in a while I have to go Christmas if I just need a little like really deep red sauce.
Okay, I'll endorse that too. And I recognize in the beginning, I didn't say, for people who don't know, I'm internal medicine and addiction. And I work for a startup in addiction SUD care, and I'm based out of Albuquerque. And I've always been a green. And then the last few years, I've also loved red. And I don't know why I'm so conflicted saying that in public, because I should be proud of that. But anyway, I think we got everybody then except for Dr. Gill, who is our special guest.
Hi, and I'm just realizing my signature literally says Dr. Gill, which is because I'm joining from my work teams, and they just made it like that to help avoid confusion. But my first name's Sabrina. I'm also an addiction medicine physician. I'm the medical director at State of the Heart, which is becoming a super, super cool clinic. We mainly work with unhoused folks. We're an OTP, we do methadone and Suboxone, and we keep delving into more social things like showers, meals. We have 200 beds in various housing units, 60 peer support workers, and more public health-esque medical care as well. And I did a fellowship in addiction medicine. I finished in 2021. Yeah, I can. Oh, she, her, and green chili for me.
All right, thank you. We're glad that you're here. And so with that, thanks everybody for having gone with that again. And also, I didn't hear anyone making a motion for me to stop having those types of introductions. So it looks like we're going to continue. But in this vein, I'm going to come back to the agenda with gratitude to Gary that he cut and pasted into the chat for people. I know also that you received it via email, and that our second item on the agenda is the update. And I will mute myself so that we can hear from Gary.
All right, thank you. Yeah, so I went ahead and put the agenda back up, and I'm going to go through these 6 points semi quickly. First of all, I would like to introduce some of our new team members. Again, Katie had the opportunity to introduce herself, and again, we're glad to have her here on the team. Rosalie Nava, she may have had the opportunity at the last meeting. I can't recall if Rosalie was on that or not, but she is attending a training today. And so that's why she's not on camera. So again, if you have not met Rosalie, we'll have that opportunity at the next meeting, and she is new to our team as well. And with Rosalie and Katie, that brings really our team of health educators to 4, and we soon will have a 5th on the team. Rosalie is the director, and then Carmen and Katie, and Diego's not on today. I think Diego's been on some of these meetings before. And then we will have another as well. So we are going to have a fuller complement this year of people, team members that can help you as committee members out with the report. So again, we're looking forward to really helping, finding data and information for you, at least, collaborating, what have you. So again, welcome Katie and the rest of the team here. With regards to dispensary tours, Carmen, I want to thank your research into this. We have received Verdes Cannabis. They have locations in Santa Fe and in Albuquerque. I know that many of you mentioned like, oh, I'd be willing to come up to Santa Fe, but frankly, I think that that's a bit of a drive, and they are willing to accommodate us in both locations. In fact, because we do have some new team members, we're going to definitely have a date up here in the Santa Fe at the Zaffarano location. But Eleni and Eileen, I know that you're down in Albuquerque, I believe, and we can definitely facilitate a visit there. I would probably maybe try to drive down to be there with you or one of our Albuquerque staff. So that being said, Kelly, our contact there, said, choose a couple dates. So I just want to put that out there for those that wanted to attend and visit a dispensary. Are there certain dates for the Albuquerque folks that you want me to run by Kelly that would be possible? Eleni and Eileen, would you be the two that would want to go from Albuquerque? Or is Santa Fe perhaps what works best?
Albuquerque would be my preference if that were possible and worked best, but I'm of course willing to drive up to Santa Fe, but Albuquerque is closer to me. And I have a lot of flexibility, so I would say work around Eileen's schedule.
Okay.
What date was that?
Well, I'm just fielding some dates right now, Alan. I wanted to make sure that we could do each location, and they're willing to host us in Albuquerque as well as in Santa Fe. So if you're willing to drive, we could definitely meet up. Is that something you'd like to? I'm sorry, we don't have a Las Cruces option, but or Deming option, I should say. Sorry. Eileen, what works best for you, perhaps?
So for me, Albuquerque would be best. I too would be willing to go up to Santa Fe, and I would generally prefer later on in the week and also later on in the day. And thank you for this work.
I think it'll be very helpful, and again, they're very accommodating, and so, yeah. Alan, is that those timeframes also sort of work for you later in the week and later in the day?
I missed the date and stuff.
Oh, well, we're just fielding time of the week. It sounds like Eileen and Eleni have some flexibility later in the week and later in the day. I know you work 2 days in the week. I think is that Wednesday, Thursday?
No, it's Thursday and Friday, but
Okay.
Monday, Tuesday, Wednesday, I'm usually free pretty much a lot.
Okay. And you would be able to make it up to Albuquerque for that?
Could be possible, yes.
Okay. All right. Well, we'll definitely keep that in mind. Holly, I know that Santa Fe, I was thinking you would probably be more apt to want to come to Santa Fe. Is that an appropriate assessment?
Sure, I'd be happy to do it here. If we decide to do it in Albuquerque, it's not a problem. I was going to suggest, a number of times last year, we talked about maybe we could have a time where we had a meeting where we were all together. so that we could get to know each other a little bit more. Maybe that'd be an opportunity in this case, depending on how much time we're talking about. So,
And perhaps maybe, that's a good, if we did do all Santa Fe, that could facilitate that opportunity. And Sabrina, I was sure you were still here. You, of course, are welcome to, as well. Are you in Albuquerque or Santa Fe?
I'm in Albuquerque.
Okay.
I'm done with work at 2 every day.
Okay, that's
So
right. We'd shared that. And this, 2 o'clock is when we started our tour with them last time. So, I think that would definitely work. Hallie, why don't I see if we can do like a Thursday, Friday in Santa Fe after 2 o'clock? That way, Eileen and Eleni, if you wanted to drive up, we could all do one giant group together and have that meet and greet at the same time. Because
then
we do.
Alan wouldn't be able to do it then, right? Didn't he say he has Thursday, Friday when he's working?
Yeah, and what I might do is facilitate Alan and you know, Alan, can you make Eleni, Eileen, would a Wednesday work or no? It would. Okay, Alan, would a Wednesday work for you?
I'm sure it would.
Would you be willing to come all the way up to Santa Fe?
Love it up there. I grew
All
up
right.
just a little north there in Raton.
Okay. Well, and Dr. Gill, I know this is somewhat early, but a 2 o'clock on a Wednesday, well, we would perhaps maybe need to make it more like a 2:30 or probably a 3, given the time constraints. Is that something that may work for you? And again, I'll come out with some dates for that then.
yes, that is
Okay.
something that may work for me.
And so if we're looking at Wednesdays, why don't I follow up with the dates? I think 3 o'clock on a Wednesday in Santa Fe then. Let me run that by Kelly and get 3 different dates for us. And then that way we could facilitate the visit as well as the meet and get to know each other at the same time. Sounds good? Okay, great. Next, the collaboration with the Medical Cannabis Advisory Board. I have reached out to the chair, Stephanie Richmond. She is very, very gung-ho to come and visit and join a meeting here and then share her experience on the Medical Cannabis Advisory Board and share the approach that the advisory board takes to qualifying conditions and determining adequate supply for patients. Today she could not come, but I'm going to keep her in the loop and she's definitely going to try to work a visit here. We do have Alan and Eileen on that board as well. And just for your all's information, the board recently did meet April 21st. They didn't have recommendations for the Secretary of Health with regards to the most recent condition they were listening, the petition they had received. And so we do have some board members there that are working on that. And so, maybe when Stephanie has the opportunity to show up, she can share with you what the recommendation from the board ended up being. But that would be, a good way for her to segue into what the board does with regards to these new conditions. I did reach out to the CRAC. Let me go ahead and share with you here. This is what was on their website. I did call them to see if they have an updated meeting time because the last one was there in January. And they're planning one perhaps in June. They do not have a date set. They're more than willing to, we can attend that meeting. It is open to public and we can view it and maybe not comment on it, probably public comment at the end, but they don't have that date yet. I will share that with you when they do have it, and they will post it with the joining information on how to join the meeting, but they don't have that yet. Their chair is actually a small business owner, and I spoke with the contact there, and she's going to try to perhaps just having our chairs discuss or talk with regards to perhaps having their chair visit us for one of our meetings and vice versa. But we've got the ball rolling there, and hopefully we'll have something in June with regards to them having a meeting. The next was going to be the SharePoint site. And again, I went ahead and sent the link out again. If you were on it and using it last year, it should still be actively functioning for you this year. If you don't recall, this is the site right here. Here's our folder still, and we have some of the information again from last year. So by hand, was everybody able to log back in and get into the, okay, great. Alan, were you able to access it? And if,
No, I keep getting kidnapped by Microsoft wanting me to do a whole bunch of hoops and things, and so I just need to bash through that, and then I'll be able to get on.
okay,
Had
and
the
then
same problem last year too.
I remember that, and I think that what I'll do is I'll reach out to you. We can maybe do a Zoom or a Teams, and I think Kathy, you helped facilitate getting Alan that access, and so I'll reach out to you and we can perhaps do it together.
Happy to help.
Okay.
Yeah.
Yeah. Oh, all right. Thanks, Kathy. And then Sabrina, yeah, as we, progressive, will of course get access to this. And so again, we did a lot of our documenting and a lot of our initial writing in the SharePoint. And that being said, the way it all came together, Eileen, there might be a different way to approach it. Perhaps instead of breaking it up into so many sections and then cobbling it together, I don't know. This was just what we had from last year. Just if y'all want to think about perhaps maybe a different approach this year if you didn't like the way that we approached it last year. And then I think we'll save this for next time, but we're going to want to go through and redo our dates. You recall this, and also our goals. And so I think we can definitely use this as a template. And then, again, thank you, Kathy, for putting this template together. It was this task template. It was very helpful. I figured, though, that we could probably tackle this on the next meeting. We might want to create a new blank one so we're not overwriting this one, or we might just overwrite this one, but I don't think we've determined that yet. But again, that again will be on the SharePoint site. And then finally, recruitment of additional committee members. As you can see, Dr. Gill, Eileen, thank you for the referral. Dr. Gill potentially is going to join us here on the committee as well. And if there are other individuals that you believe would have an impact or a desire to be on the committee, please feel free to send them the CVs, and we will reach out to them, interview them, and then of course next steps are going to be the background check and the questionnaire from the governor's office, but that is very, very easy to do. Hallie.
I'm just wondering, do we want to, looking at the current makeup of the committee, are there any specific skill sets that are missing that we might want to be reaching out to?
Correct. Yes. And again, so for example, road safety is one. Toxicology, environmental is another. These are some groupings, and this goes to there is the if you go to the original, the CRA, the Cannabis Regulation Act, it sort of does list areas of expertise that would be well utilized on the committee, and we've tackled many of those. But again, a road safety person, even a workplace safety person, occupational or toxicology and environmental would be areas to consider. Eileen.
I, of course, 100% endorse everything that you just said, and I guess wish to +1 those. I think that the other abiding thing that I would really ask us to keep in mind is that there's a lot of medical misinformation in this on this content, and one of the things I think that our group did really well that I would ask us to consider when we're recruiting additional members is that it's people who have an abiding respect for the science and will be willing to challenge their own assumptions. and and be willing to change their minds when they see what the data says, and be willing to have respectful disagreement. And all of that is a really tall ask in the setting of someone who can take time off in the middle of the day and who also knows about toxicology, workplace safety or road safety, right? But I know that we'll get there, but I'll ask all of us that when we're considering our colleagues that very, very strongly recommend abiding respect for the science.
Agreed. And yeah, so that is all that I had to share with regards to the update from the Center for Medical Cannabis. And again, I want to turn the time over to you all. We did include the first annual report in the invitations and that, and hopefully many of you had a chance to read that. Eileen.
Forgive me, I was going to ask if we could talk about item 2.6, a little bit of a transition point between that and before.
Yeah. Oh, correct. Absolutely. I apologize. Yeah. So given that we are going to have a number of new members, at least we are actively recruiting some, the opportunity to be a chair and vice chair, we want to make that an opportunity for all if that's something that the committee would like. So again, just something to consider, again, as we continue to grow our numbers. So I turn the time back to you, Eileen.
Oh, yeah, thanks. And colleagues, I've had a lot of fun being the chair and then having been the vice chair before then. And people may or may not remember that when I became the chair, it wasn't something that I was seeking, and then didn't intend to do it for more than a year because I really believe in term limits for reasons of organizational and committee performance, and also reasons of providing broadly being able to provide reasons for career acceleration, engagement, and others for lots of not to hoard all those opportunities to myself. So I really do hope that we can, that everybody here considers himself as a possible chair and vice chair, and we'll welcome that discussion at this time. If anybody wishes to have that now, if you wish to think about it, then that's okay too. We can always circle back at our next meeting, but would love that consideration now.
I would say that, like everybody else here, we are all dealing with lots of issues. I don't mind continuing as vice chair, but I'm not sure I'd want to be chair, nor do I necessarily want to be vice chair, but that's up to the committee. And if somebody needs to be there, I'm happy to do that. But we can also have further discussions. On the other hand, if one could have the power like the new Pope or our new president, that may be a different question, right? Just kidding, everybody.
I feel like this is the time to do something like that's the right with my scepter. Hallie, thanks for saying that. I appreciate it. It sounds like you're reluctantly being considered to be chair, and I heard that tail end when you said, or we can consider to discuss it. Maybe what we'll do with that in mind, I don't want to ever pull anyone into a role that they don't want to take on. I have an idea, but I saw Gary was just going to say something.
I was just thinking that, if you want to continue on the conversation, perhaps when we had that in-person meeting might be another opportunity to cultivate this topic, or that's all, because I was making my notes about Wednesday at 3:00 at some point in the near future. Hopefully we'll all be together. So, but that's all that was popping into my head.
Okay. I love that, because then Hallie doesn't have to feel like he's reluctantly being pulled into something, and also that he's not surprised, do you want to be the chair? And that also any of our colleagues who aren't present for the call today, then that they get a chance to consider themselves in a leadership role as well. Thank you.
If you want to get on the phone, Eileen, and talk about it, I'm happy to do that. And Gary, but separately, I think, from this meeting.
Okay, thank you. Thanks.
Hey, Sabrina.
Bye,
Thanks
Sabrina. Thank you.
Yes, nice meeting everyone.
You too.
Can I ask also, with Haley not on the committee now, is she not going to be on the committee? Is she gone
She
from the
will-
DOH?
No, I believe she will carry on her similar role as before. She just had a conflict at this time.
Oh.
This late in the day is a little bit of a conflict for her, and she did let me know that she wasn't going to be here. But she, I do believe, wants to continue to participate in much the same way. And I found her insights and her access to the data to be wonderful. And so we'll definitely rely on her for some of that as well.
And it's good to hear. Okay,
Yeah,
great. But I take it that our recommendation to the state legislature that we got a full-time epidemiologist for the department, for this committee, the department, and then working, that didn't go through, I take it.
At this point, no, not yet. And so,
Okay.
but we are lucky to have her when we, as much as we do. So,
Yeah,
yeah.
she did a terrific job last year, and I appreciated her work very much.
And she brings a lot to the meetings as well. I always appreciate her insights. So, but yeah, and so she should be back with us at some point. Today was just a clash. So,
I see. Okay, thank you for clarifying that.
and I did want to let you know that Kathy did put the annual report schedule there in the chat. So that is there. Okay. But yeah, back to you, Eileen. I think that one thing that we had talked about during our last meeting was perhaps reviewing the document, reviewing the report, identifying those areas of strengths, perhaps those areas of weakness, but maybe even, perhaps those areas to improve or to expand the document, because that's always exciting as well. So, Eileen, I'll return the time to you.
Yeah, thank you, Gary. And I think that the way that you've put it on the agenda is really nice. That I think it's first talking about the strengths. I have my own thoughts on what I'll reflect on. That first is that we delivered on the ask. We were asked to do something that was quite a big lift, and we really did it. And building upon what I said before, I think that we should feel really great that we not only did we focus on what is relevant to New Mexico, where there was data, but we also had the transparency of when there is data and when there is not, and that our recommendations are evidence informed. I think that everybody should feel great about that, particularly in the landscape of those headwinds about that there's a lot of misinformation about this. So I think that we should feel amazing about that, and that I thought that the work was also very collaborative, and that I thought that it was there was a lot of opportunities for people to engage in multiple different ways in the final product. And maybe I'll pause there because I would love to hear other people's reflections on what are the strengths of our approach.
Have we gotten any feedback from any legislators about that, and what it was good, what was bad, what could be included later on?
Not at this time. I haven't gotten any concrete real feedback from that I could share. Sorry about that.
Gary, I think that, Alan, that's a wonderful question. And Gary, do you usually find that, so the timing is a little bit funny, right? Because the session isn't long afterward, but a lot of the work in the session is actually based off of what happens between the sessions. And it's the meetings that are coming up like over this summer where one would be able to draw upon those. Do you usually find that on this sort of possibly unusual timeline that there could be more feedback as a result of the hearings this spring and summer?
Hopeful, but again, this being the first year that we've really had the report and submitted it to them, I can't say. There's also the large distraction of the psilocybin issue going on. Now, that being said, I do think that we are going to be in the presence of a lot of the legislators, and they're going to have a lot of intrigue with regards to that piece of the program. And so I think we're going to have the opportunity to request feedback. So I don't have a lot of experience saying that we definitely will, but I do foresee opportunities to get some. And so that will be a goal of mine.
Thanks. Hallie?
So I want to thank you, Eileen, because your comments were exactly what I had written in ahead of time, saying this was really, I thought it was well done overall, and it was a good a good compromise among positions in many cases, and also those who did the individual sections. Some of the folks did more than one of the individual sections initially, really did a beautiful job writing them, and I appreciated that. Going back to the question on and how it gets used, are there some things, Gary, that you can recommend, or maybe Brenda or somebody else from the department, as to how we as individuals can try and get this in front of key legislators for the key committees, to ask them to take a look at it and bring it to their attention in a sense?
Do you have any ideas? I mean, are you familiar with certain legislators that you have the ear of, perhaps? Is that because they've all received it? I guess the question is, in a more personable conversation, injecting it into it, is that sort of and again, Dominic is in the same training as Rosalie. He typically always has a good lens for this. But Eileen, what were you going to I'll share.
Yeah, I was going to say that I had sent it to the to KUNM, the Santa Fe New Mexican, and also to the Albuquerque Journal, just in the spirit of that this is about New Mexico for New Mexico, and possibly could be something that they would. I've had other things, like when I sent the research papers that I had published, have had those run on KUNM before. Because they're about New Mexico. And I didn't hear that none of them were picked up. And I can understand why, because there's kind of a lot going on. I don't think that it's too late for that to come from individuals. I would ask that when we do so, which I hope that everybody here considers that we are really clear that we're acting on behalf of, not the Department of Health asking about a specific bill, anything like that, any way that we could jeopardize the positions of people who this is their day jobs, and that we also, options that are available to us, to anyone, which is different than your great question, Hallie, about key legislators, but I would welcome all of us to consider drawing upon this when writing things like op-eds, because now we're in like the period where there's local newspapers are really read by local elected officials. I don't think that we should ever underestimate that, or whatever context that we have for other sort of lay press, lay media, also too, like the local radio stations, stuff like that. I had written a couple of op-eds and letters that were in the Santa Fe New Mexican, and was interviewed a few times by Richard Eads, the voice of Santa Fe. And I think that anybody here would be able to speak to the work that was done, as long as we were clear that we're speaking on behalf of ourselves.
Sure, and I think the only way you really get a legislator's attention, especially when they have 50 reports sitting on their desks of some sort or another, is a personal touch, and even going in to see them. I mean, I'm happy to go to the state legislature and talk to Irina Shapansky, who is the majority whip, is my representative, for example. And but I just wanted to do it to make sure that as a committee we're coordinated in a way and understanding in a way that we wouldn't be stepping on each other's toes, or stepping on others' toes that could be problematic for the department, for example.
I think that would be fine. And in fact, Rena was one that was on the bill for the cannabis testing bill. And so I think she's invested in this theme and this topic. And I would have hoped she would have read the section on workplace safety when she was drafting pieces of that legislation. So again, I think Eileen said it well, representing yourself, but making them aware of this document, and then having a conversation perhaps. And I do think we all have different, perhaps depending on where we live, different legislators, but also there is going to be the special session too. So it's dawning on me that could be another opportunity to really sort of get some circulation to the document. I think that the governor's going to call one.
Yeah, I mean, I think we would want to understand, or I would want to understand, and maybe we do this offline, Gary, is what other policies the health department's really interested in, so that when we're there, we can make sure we sort of coexist with those policies in a way in discussion, or at least we don't step on those toes. And I'm not saying that we're not paid lobbyists. I'm not suggesting we should be doing anything, under the table or anything like that. That's not my, it's just that if we can coordinate or in some way be aware of that could be helpful to all involved.
I think that, hearing about Eileen's sharing the report as you have done, just keep each other updated definitely is one. I mean, appreciate, Eileen, that you did all that. And I think that, the Santa Fe, New Mexican, I don't think you mentioned them perhaps. So maybe that would be another option. I think the op-eds are great because that personalizes it definitely to the individual. So Eileen, I saw your hand was up.
It did. I was going to say that I really appreciate the consideration about what could be a priority for the DOH, and I also feel like I think that that's really strategic. I think it's also really important for the committee members, just to if referring to the report, that we stay within the lane of the report, so that then there's no way that we can step on any toes or working cross-functional with the DOH, because we really are just sticking with the work that's already been done and that's got the imprimatur of the DOH without risking sort of muddying the water for anybody. And if anybody here wishes to co-author an op-ed, I would be delighted to do so. I think that I don't understand why the Santa Fe New Mexican always runs my submissions. I think that they must not be getting a lot of them. But I've got 10 in there and I'm not quite sure why. And so we could go for 11 together, or you can do it yourself and I'll just be thrilled and amplify it.
Well, Inez is pretty open to lots of different viewpoints. I think she's the op-ed editorial page editor. And so I think that's good that we have that you have a relationship with her, I have one. And so we can get things done there as long as they're reasonable and that kind of thing.
Yeah, thanks. Well, Lenny, I welcome everybody to consider an op-ed. I feel like, or the other ways that you wish to amplify. Sometimes, of course, a message needs to be repeated several times. So yeah, please do also send it again to KUNM. The KANW, I think, is the Northwestern, is the other station. Send it. I realize I never sent it to Richard Eads. I should send it to him. And to the Journal, etc., to the New Mexican, please, whatever outlet that you think is appropriate. I hope that you consider doing so. I don't know that Eleni knows that I had suggested her as a grand round speaker at the University of New Mexico because she was so impressive. I don't know if they reached out. Yeah, sorry, I just told them you were amazing. And so I think we have identified that there's a lot of strengths and there's a lot of ways to try to get this out there. I think that we've ended up segueing into one of a weakness or an opportunity of improvement is just how do we get the information out there? And I wonder if I can also ask people what would be some other things that are lessons learned that we might want to do differently this year or this time moving forward. One thing I will say that I identified was that we ended up, we had started saying that we had a certain number of recommendations we were going to end with, and we ended up sort of being a little less focused on that and going a little bit more broadly, and that there can be pros and cons to that. I think how we ended up there was because the data supported it and the need is there. I think sometimes one chooses to have fewer recommendations because then it can be perceived as more achievable, and can be perceived, and could either be perceived or actually be more strategic. I think that as a chair, I ended up not saying, no, we're not going to do that, even though we talked about it before and we had all the recommendations in there. And I think that next time we can have a little bit more intentionality if we want to continue to have more recommendations, or if we want to go to fewer recommendations and then stick with whatever we choose. I'm excited to hear what other people think were. No, so I thought it was also a little bit long. I think we thought we were going to get to 20 pages and we were over that, but it was great content and that was more important. But I'll pause here because I'd like to hear what are other people's observations about opportunities for improvement.
I guess I
Lenny.
can.
Eleni?
Yeah, I can talk. Nobody else is talking. Yeah. So, Eileen, just sort of tagging off of the last thing you said. I think that one of our weaknesses that you and Hallie sort of came together to fix in the 11th hour was that it was quite long, and also there was a lot of areas of repetition, which probably could have been anticipated given that there were so many things that were important, but could have fit into multiple categories. For example, pregnancy. Katie and I ended up both covering that very extensively, and you guys were able to like pull that into one section. And so I think that that was addressed really well by you guys. So thank you for the work you did to sort of bring that together. And I think that this will make our work going forward easier because we'll know we can kind of use the first report as a template to know exactly where we're going to put data and where we're going to talk about information going forward. So we're not repeating and duplicating work. And I've been sort of thinking about like how we frame the report going forward. Like, do we assume that, there's a lot of background information in our initial report, which I think is really valuable in a state that's, moving into commercial use for the first time, but that we maybe don't need to be repeating that information every year, that we can be a little bit more concise in our, background on X happened in other states with children when, this legislature was introduced, and we can kind of, maybe say like if you want more, like allude back to last year's report, and that might make it more concise, and also that might make it more accessible for folks who are pressed for time to read, and so that will hopefully we can make it even more streamlined going forward.
Fantastic observation. Yeah, it's more accessible, and that's the key thing. It's not how do we make people read our report, is how do we make our report something that is compelling to read. Yeah, thank you, Lenny. Yeah. Kathy, I see your hand is raised as well.
So my comment is more around the how do we get it out there, is that, I recently had a meeting with our communications and marketing, and I don't know how it would fit, but that we might consider the use of social media. They did say that our medical cannabis posts outperform most other things that they do on their social media. So people want information about our program. So it's another avenue that we could, tap into for this year. So
it's a great idea. Thanks. Yeah. Team, any other reflections about some lessons learned? Alan or Hallie? And also thank Gary. Gary, I'd like you to have the last word. But Alan or Hallie, anything there?
No, I mean, it's hard to sort through all the literature. I think, as you were saying, Eileen, we really need to focus on the science behind it as well as the data that we have locally meaning in the state. It might be useful having more other state data where it's more comprehensive, where we can show that there are other ways to look at this, perhaps, so that it maybe strengthens our desire to get a more full-time epidemiologist in some way. But that may be something we want to look at, is what are our long-term goals versus our short-term goals, and how do we support those goals in our report in a way that could be positive related to it. So, there's no reason why we can't have a final section, not just on policy, but also stating either explicitly or implicitly what those goals are and what we think could help support them going forward.
Thanks, Hallie. Maybe, Alan, did you have anything, or was everything you were thinking has already been covered? I see that you're muted, so I'll assume that I shouldn't make assumptions.
Got a lot of things bouncing around in my head there, and looking for what could be reappearing, what could be new science, new data, becomes a big difficult subject to cover. But one of the things that I wanted to throw a question out, which is kind of distantly related, is on the news media recently, we've seen a couple of things that came up that I wonder what effect or what we should think as a committee about. Recently, there was an investigation showing that a lot of the little convenience stores are selling, let's call it cannabis, but it's labeled as hemp, but it also shows that it has THC in it and in colorful, neat packages, which was one of the things we wanted, blah packaging, to keep kids from wanting to get it. Different things related to this and things outside the laws that cross over our theme a little bit.
And I'll segue from there. It's just like, I think that we could almost look at the legislation from the last legislative session. And I think we can garner from that where a lot of the questions are. Now, I'm not saying that we begin to write policy. No, not at all. We're going to let the legislators develop that. But if you're intrigued to know, well, there was some answers that they could have used with regards to the way they were approaching the testing of safety sensitive positions. I thought that was a horrible piece of legislation. I'm just, that's me. Yeah. And so that could be a resource of, what are people curious about? What do people need answers on? And here we have a document that could be utilized in the analysis portion of those bills should they come up again. So I just sort of share that as a segue from what Alan was sharing. But with regards to improvements, one thing is I need to get the feedback from the legislators. We want to hear it from the horse's mouth, what they like about it, what they found good about it. And I think that that is an improvement that I'm going to take from this meeting today, because they might share one or two things that really would be pivotal in the way we approach it, or they might just say, hey, it was fantastic, and not have much to share. And at that point, then we can go with, what instinctually feels well. But I think that that's one thing I've identified is it would be very helpful to have some of that feedback going here for 2.0. And so I will work on that.
Thanks, Carrie. I think that really nicely segues into the discussion, items 4 and 5 of the discussion of short-term goals and long-term goals. And I think for short-term goals, I think succession planning for the leadership of the committee is one thing just to consider operationally. And then developing our work plan. I'm not sure to what extent it is a short-term goal versus a longer one about that feedback from the legislature and from members of the legislature, and the possibility of inviting any of them to the meeting to give us feedback, if possible. I don't know if that's grandiosity on my part, but a citizens legislature sometimes wants to be in front of people, or not. I don't know. You'll know that better than me, and I don't know if that can be perceived as partisan or meddling, and I never want to do that.
I think that's a great idea. I'll look into that, follow up with that. And again, I think it's finding that right individual also. So, but that opportunity that they would have to share would be probably really helpful. You mentioned the work plan and then the feedback, and then yeah, I'll look into that and see if we can have somebody perhaps at one of our upcoming meetings share something.
Thank you. I hope that wasn't grandiose on my part. I'm going to trust you to let me know. Oh God, everybody knows he didn't say, yeah, Eileen, that's not grandiose. Okay, good to know, Eileen. I got it.
Oh no, I'll look into it.
Okay, thanks. So
Hey,
colleagues,
if we don't ask, the answer is always no. So
okay, thanks, Kathy.
Let somebody else tell us no.
Appreciate
Not ourselves.
you.
Yeah.
Who was it who sponsored all the psilocybin activity?
And that's what, when Eileen asked that, it got me thinking. I'd have to say that Senator Steinborn and Senator Hickey were the two main proponents of that legislation. And I do think that Senator Steinborn probably was the more active of the two. Senator Hickey is a physician by train. And so, he would definitely have, I think, some insights. I would love to hear his feedback, being a physician, what he thought of it. But I think that Senator Steinborn might have more I think he enjoys the interactions a little bit more. So again, they could be two that would love to come and share. So again, that's a sort of where I was starting from, Hallie, and I think you were thinking the same thing. So, but there are others as well that were more integral to the cannabis portion of it. Andrea Romero, who is here in Santa Fe, she might, Javier Martinez as well. So those are others that might foster the opportunity to come talk to us. Again, I'll have to delve into, yeah, I don't see a reason not to have that feedback. It's something we want. I guess the question would be influence, but that's a question I'll let them figure out. Like Kathy said, if we don't pose the question, the answer is always no. So
Thanks.
I would
Kelly?
also.
Oh, Eleni, yeah.
Sorry,
Go ahead,
I was just
Eleni.
gonna say there's also just a question of timing. Like I don't know when exactly we would think about giving folks time to read this and then giving this feedback, but I'm thinking that it's May and we wanted to have a final draft kind of all the sections by September, sort of looking at the last year. So given that I don't even know that we've started the process of data collection yet. We may be a little bit time pressured. We may need to start writing, at least drafting soon, and maybe sort of have a work in progress as we're getting feedback. I don't know if we're kind of working on the same time frame from last year, but that's sort of been in the back of my mind.
I guess part of that is how different did the report. How different is it going to be this year? Is it going to be an expansion of the previous sections, or is it going to go off in other tangents that are, so that also perhaps would play into that time or lack of time. And I guess that's what we're here talking about. Like, what direction does the committee want to go? Is it simply expanding upon what was there, or is it really, going off on some divergent and more, newer themes?
I was just going to say part of it may have to do with how the data may change, if at all. I mean, if there aren't substantial changes from 2023 or 2024, depending, I guess most of our data were through 2023, then we will have less to say about that, right? If there are huge numbers of additional emergency department visits, we'll have more to say about that. So one of the things we may want to consider is putting together our sort of key indicators that we want to follow from year to year. Now, we have a lot of them already articulated in the charts that are in the report from last year. And then we can have comparative data. Maybe we find a way to summarize that so that we don't have to repeat, as you were saying, Eleni, as much, but we can show how things have changed from year to year without being repetitive in that sense. And then go into other things that may be more important. Or if there are no other things that are more important, keep it as a short report.
I have a suggestion, which is I think that we heard that that our next meeting that will have sort of the work plan by the dates that repeats the schedule for next year, that we'll have that ready to go. I think that and that will be, I think that will be between meeting work. I think I'll challenge us to consider that even if the frequencies have changed, are we going to change our recommendations? because it would surprise me if we meaningfully changed our recommendations, because our recommendations are very data informed, even including for data outside of New Mexico. And it would surprise me if we would end up with a different recommendation about packaging, about education, about workplace safety, about those types of things. And I say that just recognizing our bandwidth is pretty limited. So unless we meaningfully think that our recommendations are going to change, I would recommend that we consider that our scope be narrow and more of updating the recommendations that are updating where it will be meaningful, the background information that that undergirds our existing recommendations, and that we consider honing our recommendations to be even fewer. There also is real strength in having consistency to our recommendations from a year-to-year basis generally, because in the world of legislatures, it usually takes a few years to get anything across the finish line. Gary just raised his hand. What are you?
I just had someone at my door. So
Oh, okay. Okay, all right, go get the door. Yeah. So I'm going to ask us, how do we feel about that? Thinking that it was a great experience to do so. It was a phenomenal amount of work to hone our parallel efforts to be to reduce the parts where we had to maintain the healthy redundancy, but to trim the parts that didn't, and to have a similar editorial style, if you will, in copy editing. So with that in mind, and the timeline, as Eleni reminded us of it, I'll ask us that we very seriously consider between now and then, do we wish to end up with the same recommendations, or do we have any reason not to? And then working backwards from there instead of working forward. And I say this as somebody who's like you, has been following the literature. Like my day job is addiction and public health. So I'm curious about your thoughts. Ooh, Carrie's got a lot going on.
I like your ideas. I think it makes good sense. Keep hunting for data that can strengthen or eliminate, and fit those in where they go, and picking out things that are less important and do away with a little bit of those, concentrate on the most important things, and polish those up a little bit better.
Eleni, thank you, Ellen. Yeah, Eleni. Yeah.
Yeah, I once again, thank you for doing that work to sort of bring all those parallel pieces into one report. That was, I can't imagine how many hours that took, and that was that made it readable, and that really brought the final product together. So thank you again for that. I completely agree with what you're saying in terms of thinking about what our endpoint is in terms of our recommendations. And I do think that being really focused in those, I think that's a great idea to work back from that while still updating the data where applicable. I think there are some sections that really lend themselves well to updated data in a brief commentary, like the emergency department visit section, the poison control calls section. I think those can be very appropriately and concisely updated if Haley is on board to help us with that. The only thought I had in terms of sort of recommendation and points of emphasis is, maybe this is just me, but as I was reading a lot of the literature, I felt really strongly that the evidence is increasingly compelling that pregnant women should not be using cannabis. They have better options, that there are, of course, there are individual patients with individual medical cannabis concerns, but in general, I feel really strongly that maybe this the perception of cannabis is like maybe being safe because it's natural during pregnancy is absolutely not true. And I think that sort of the general public being more aware that there's danger here, and protecting pregnant people and protecting their babies is something that I feel passionately about. And I think that maybe the current labeling isn't as strong as it could be, and that might be an area that, if I were to choose an area to emphasize more, or to have a point with recommendation, that might be one thing that I would want to add. But other than that, I think that the current sort of areas that we're focused on in terms of recommendations in last year's report are all really powerful, and I think that we should continue to emphasize those.
Thanks, Melanie. And yeah, that data is really alarming. It's very alarming. Yeah. Hallie?
So I'm not arguing against what anybody said. I guess my sense is that before we make a decision exactly what we ought to be doing, we ought to look at the data, just as you were suggesting, Eileen. We want to be data driven. You know, in financial management, when I used to be on boards of companies, I was always more interested in zero balance budgeting rather than continuing along the same budget where you just keep adding money to various departments. And in a sense, I think of that with the data too. You look at the data, you say, are there changes in the trends? If there are no changes in trends, fine. Then and then you look at our recommendations and you say, were our recommendations from last year consistent with the data? I think they were, but we might still ask ourselves the question, what other kinds of recommendations or data on the data might be as powerful or more powerful than we have? And that's the way I would approach this personally if I were writing the report by myself. The other thing we might consider is, instead of having, or in addition to having, the committees of the 8 prescribed areas in the legislature, but from the legislation, that maybe there's some ways to rethink of how we organize our subcommittees so that, for example, I don't know, we get very specific about strengthening recommendations about pregnancy abstinence. Rather than talking about all children, we can say to look at all children. You can see the report, and we can give the link to last year's report, for example. And I don't want to get too prescriptive on how it ought to look, but there may be other ways to organize ourselves that would help us seriously look at the questions that may still be arising, that may be more important or as important as how we did it last time.
Yeah, I think so. I guess what I'm hearing is what I'd like to suggest what we do moving forward is this, which is that between now and the next meeting, that we'll send a survey, and we'll ask everyone to spend their time with the report, as well as doing a review of the literature that is available. And I'm going to trust you to have the scientific integrity and the timing that you'll be able to lend to that, and then to vote. This is the way. I'm on the Healthcare Workforce Commission, and which is also unsupported, and it's. I mean, here we have like wonderful DOH colleagues, right? But that's one that's volunteer driven. And what we can do is that then we'll vote on them based on what we know, and we can say the reason why. And we'll vote on like sort of what will be our priorities. And then that is what we'll choose to focus on. And that is where we can choose to direct our energies for where to spend the most amount of time refining the evolving data and how we present it, and how the wording of the recommendations should change. How does that sound, team? Because I think it strikes a nice balance with the timeline, the bandwidth, and also not the timeline, the bandwidth, and also building upon a foundation of something that we already that we know is not just rigorously done, but that also strategically it's a good idea to build upon what you've already done when coming back to anybody, rather than whole cloth presenting different recommendations. So that's what I'd like to suggest, I think, based on what I just heard. And what I'd like to hear is if there are, I'd like to hear what Dominic says, who just joined. And I gotta say, before you share your other thoughts, red or green, because we talked about that earlier, and I don't remember what you said when it was like 2 years ago when that was our icebreaker.
Oh, yeah, it's really easy. Christmas.
Ah, okay, of course, of course.
You know, unless it's the what we've grown, and then actually it falls to red. So,
Okay,
because our red just
nice.
seems to have a better flavor. We can't get quite as good a flavor with our green, it seems like. So,
Okay.
yeah, and thank you. And sorry, everybody, that I couldn't be here for the first portion, really for the first two-thirds of the meeting. I was having to do one of our mandatory trainings, and this was the only day that I could attend it. And so, but I could hear, because Gary and I share a wall. So I actually could hear Gary's conversation with you all, and it sounded like things were going pretty well. So thank you all again. But what I just kind of wanted to say a little bit as far as from a format standpoint, I think Haley is right on it, except that we do have to make sure for the legislature that those 7 categories kind of have at least a little bit of a synopsis. And then, because now we're beyond the first report, then what can really happen is there can be additional sections, additional information that can be added in with, whether it's areas that need to be researched more, areas of concern that aren't included in those, or even a little more specific of, subsets within some of the or the statutory required areas. So, I mean, the format can change a little bit, but there will need to just be at least a section of it that sort of hits those statutory requirements with at least a little synopsis in it. But that doesn't mean that the other items can't be added now. And in fact, I would encourage that.
I so that I can make sure that I understand that when adding other items, what has been our experience with having many more recommendations, having a lot of recommendations, and then versus having fewer? I can only speak from the other. My experiences have generally said they're trying to be fewer and try to have consistency from year to year, rather than having more and more, from almost like from an organizational psychology perspective and from a change management perspective. But that may not be what applies here. What are you thinking of that I'm not thinking of?
So what I'm kind of thinking is you still have to have the sections, so the statutory required sections, but they don't necessarily have to have a ton of recommendations. I mean, and they could be the same. It could be as we go through all the different data, they sort of match. And so we have some that just continue to follow on, changing some of the language or strengthening some of the recommendations based on some of the new data, for example, the labeling and the warnings that need to be added. All of that is good. But it also can add additional areas that may not be included in those statutory conditions, or sub areas, for example, with pregnant individuals, and really highlight those. And then when the report is done, it can actually state, in it, have an area that says, here are the most important recommendations. These are the priority recommendations from this group. And then have the rest of them outlined with the data there. So you're still providing whatever recommendations come out of the group, but maybe highlighting the top few, if that makes sense.
Okay. Yeah, thanks. So I feel like then we might have the opportunity to do that. Will in between this meeting and the next, that we'll have a survey that asks which are the most important of that are present, and why. And I'll ask everybody to look at the data that is available, and what is like the literature inside and outside New Mexico that's available to you. And then what additional areas would you like to have added, and what are sub areas, and then we can vote on that. And I think that can help guide us working back, rather than the working forward with this whole world of we don't know where we're going to end up. Again, managing bandwidth, because we've got fewer people now than we did last year. We have a lot fewer people who are able to do the work.
And
Yeah.
we're working on that part too.
Oh, which is wonderful. Yeah. Hallie?
So I want to get back to the question that you asked. You just stated that we have fewer people to do more of the work in a minute. But if any of you are familiar with Think New Mexico, which is a lobbying organization, it's a policy development and lobbying organization, nonprofit. I mean, what they do is they put together a document, and this is not the only template, obviously, one could use, but they've been doing this now for 20, 25 years and have been pretty successful. And the idea is that they lay out what their agenda is, but then every year when they lobby, they only lobby for 2 or 3 of the key ones. So I think what we're talking about in many ways is somewhat similar, right? We want to get the data out there. We want to provide an opportunity for the legislators, if they're interested in reading our document, to see what the breadth and scope of our issues are, but then have 1, 2, 3, 4, whatever the correct number is at the time, to actually be highlighting, as you say, Dominic, and as Eileen is suggesting. So it might be a good idea for those of you who haven't seen Think New Mexico's style. You can go to their website, and they've done an amazing amount of work on education, school level education in the state, and an amazing amount of work. Now they've just taken on getting more healthcare practitioners into the state, with a lot of recommendations on how that can be helped within the scope of what already exists in the state, in state statutes, and also recognizing what the pros and cons of the universe of lobbyists in in the state might bring to the table. Because if there are unrelenting forces that would make some recommendation impossible, it's not necessarily valuable then to go down that road, right? Even though we think that's the best thing to do. Just something to think about if you want to look at another template that's not a health related per se template.
Yeah, thanks. So colleagues, we'll plan to do that for between now and our next meeting, and I'm looking forward to hearing from everybody. I know who you are, so I need to hear from you. And then I feel like what it might segue us nicely to, and I am hoping that we can end at the bottom of the hour, just out of respect for people's time that we started, just to start on time, end on time. Any other considerations that you have around long-term goals? I feel like what are the ways to challenge us to always remain consistent with the data rather than with ideology, or with political expediency, or some outdated ideas that don't reflect harm reduction, and sort of like walking that path. So I think a long-term goal is, how do we ensure that that's going to be the case? I don't know what that looks like to ensure that, but that is one that comes to me. I think also balancing the resources that we have available to the work, so that we aren't asking Tiffany's for a $20 watch, is an expression that my mom uses, so that we are realistic about what we are able to achieve, and balancing our bandwidth and our resources as individuals. And and remaining and being relevant, being readable and actionable at all times, and ensuring that, rather than a scholarly exercise that is about my passion projects. So I'll pause there because I want to hear what other people have to say. So I did my count to 10. And that's okay that I didn't see anybody's hands raised. It could be that it's like 4:20. And that could be why, but I know that you know that this isn't your only time to talk about other long-term goals. Hallie, please.
Well, so the second half of my prior statement is a question: what happened to those other people who have left the committee, or those resources that we no longer have? And are they, other than getting new committee members, obviously, which we have to go out and recruit, are there also deficits in the folks in DOH who can be helping us at this point, or are they still available? It's a multi-part question. A, B, C, or D answers. Yeah.
And I can help on answering that. And then Gary, if you have anything else to add. I mean, part of it is just with a variety of different things that have been happening. Some of the other committee members just had, as life changes and priorities change, had additional things happen. And so it's actually pretty normal. In fact, quite honestly, this has been one of the more stable committees that I have seen over the last 15 years at Department of Health, as far as for its size. Some of the larger committees sometimes tend to have a little bit of a bigger core, so they seem to be, to have more continuity, so to speak. And then as far as for some of the resources at Department of Health, we do still have some of them, but they, quite frankly, they are experiencing some of the changes that are occurring due to the federal funding. And so we just are trying to be cautious in not overloading them when they already, quite frankly, are overloaded with changes. Now, we've been very lucky here in New Mexico, even though there have been, or there were some attempts at reducing some of the budget, and our state has been successful in actually being able to fight a lot of that off through the courts and other means. So we haven't seen as much of an impact, but anytime there's the kind of situation of job insecurity, you have people who are, they're trying to find other things, quite frankly, because they don't know what's going to happen. But we've been very good here at Department of Health, even when the cuts, the original round of cuts hit us that they thought were going to be implemented. The first thing that really was said was the budget needs to be reorganized in such a way that so that nobody loses their job. And that did happen. So even though we were able to successfully get that funding back in those initial rounds, nobody had lost their job. And so we do still have a lot of the resources available, and we hope to continue to have them. And we keep looking for backups to make sure that people are funded and don't have to stress about their job, just having their job. But I think that's part of what, is kind of affecting a lot of people right now. I hope that answers it for you.
Yeah, thank you very much. I'm wondering your background there. It's a huge room you're in, and is that the ocean behind you, or is that?
It is, but it's
Oh.
just a regular background. My office is so boring right now that I just have it on. I just have it so that there's no nothing else here. I'll show you if I have none. That's my
Oh.
office.
Okay. Oh, Eileen just that's a
Yeah.
quick flight. What did they say in not Star Wars, but the TV show? Beam me up, Scotty. So there you go.
Yeah.
Okay.
Yeah.
Thank you, Dominic. Understood. And sure, one would hope, given the resources and all the discussion of the oil and gas activities going on, I mean, that could be another area that we can help in some ways from the outside with the Department of Health to see how we can get some more of those resources in. But that's a whole nother question, and we can discuss that another time.
Sure. And just to let you also know is I'm actually have been talking with some of the faculty over in population health, and they quite often have internships and students who need to do practicums. And so I'm hoping that we're going to be able to get some additional help through there, as well as helping to support and the education of some of our future, leaders in health.
You might also consider, and I can discuss with them, that the preventive medicine residency also has
Yeah.
placements, and that's in the internal medicine department, not in the
Right.
family and community health, community medicine department. So,
Right. That's a great idea.
Thank you. I think for a time that we probably won't be able to get to very much else, because I would like us to think about our scheduling our next meeting. And I'll ask for the reflection. It seemed as though when we thought we would meet at 3:00 later in the week, that it seemed that was a very popular proposal, but I do see that we have fewer people than usual. I think initially it seemed like it would be very popular to meet later in the week. than our previous Tuesday, and also later in the day. I'm willing to give it one more try before we switch back to earlier in the day, earlier in the week. With that in mind, and considering all of the work that we've described, I'm going to ask that we can consider June 12th also at 3 p.m. And we'll ask if you would raise your hand if that does not work for you. Oh, I see Eleni is not sure. Okay. All right, Alan, thanks for the thumbs up. And I did ask people to indicate if it doesn't work for you, and I recognize that that is a confusing direction. It would have been better to say to indicate if it does. So a thumbs up if it works for you, just like Alan had given us one. Thank you, thank you. Hallie, are you going to be globetrotting at that time? You are. What country are you going to be in?
Well, I'm hoping it'll be Iceland, but we'll see.
Okay, okay. All right. Well, I know that in between that you'll let us know about, well, hopefully we'll all see each other related to the dispensary tour, and that you'll let us know about the voting that we'll do between now and then. And we'll look forward to what you have to say. And thank you. So
in theory, I have to say, in theory, I could, though I'll be on the East Coast, literally on the 12th is when I leave for Iceland, but the 11th or 10th would be possible for me. Otherwise, if we can have that flexibility. But don't do it around my schedule is what I would say, because you never know when the dog might be coming in or the grandkids might be coming in beforehand. So
we always hope that the grandkids are coming, right?
Well, we'll be in the house of the grandkids on the few days before we go to Iceland. So
I see. Okay, nice. So with that in mind, team, I know that the let's see, do we want to try the 11th? I'll ask you if also at 3 p.m. if people would indicate a thumbs up if that will work for them. Thank you, Eleni. The 11th at 3 p.m. Okay, Gary's nodding. Alan, does that work for you?
That's June 11th?
Yes, thank you. Yeah.
Sure, perfect.
Okay, fantastic. All right. Well then, team, we've figured out that we'll next meet on June 11th at 3 p.m. Between now and then, you'll get some homework to do. And between now and then, I hope that you have the really great days that you deserve. And I will ask Gary what other concluding comments he has that I haven't, and any other issues that I neglected to bring up.
I think June 11th is a great day. I think that Dr. Gill had mentioned that after 2 p.m. works for her. So I think that that will likely be a very, very useful day. And then again, with regards to, we will not do a dispensary tour on June 11th. We'll hold our meeting on that day. But keep in mind the other Wednesdays, either perhaps the 4th or the 25th or July, a Wednesday here in Santa Fe, perhaps at about a 3 p.m. Dispensary tour with those who can make it. So Dominic, just to bring you up to par here, we are looking about everybody coming to Santa Fe, not necessarily bifurcating and doing Albuquerque and Santa Fe, but including Alan. And even Dr. Gill, I think, said that she'd be willing, Sabrina, I should call her Sabrina, coming up to Santa Fe. And that way it would be an opportunity to actually meet and be in the presence of the other committee members. So I'll get dates and send those out to you and then just vote on that as well.
That sounds great, by the way. Yeah.
Okay, wonderful. Well, I hope everybody, again, have a great day. Enjoy your red, green, or your Christmas. On eggs, potatoes, cheeseburger, and I won't judge you if you just eat it right out of the bowl with a spoon. Okay. Thanks, Shell. Take good care.
Fridays
Thanks,
are a
everyone.
ranchero special, so that's Fridays.
That's a good choice. Thanks, Alan.
That's fantastic.
Bye, everyone.
Right. Bye, everybody.